I'm a mom of 3 kids.
My youngest is 5 years old. We call him Rowboat.
They are parents of kids with disabilities.
He has been diagnosed with severe nonverbal autism.
2 sons that are on the autism spectrum.
I have a 13-year-old daughter. She is medically fragile and she also is intellectually disabled.
Now speaking out about their ongoing battle to bring back what their children lost with the pandemic. According to the state contract database, at the end of May, Florida agreed to pay Maximus $6 million over 4 months for contact tracing services to prevent the spread of COVID-19. By mid-July, it extended to a year, its dollar amount more than quadrupled to $27 million. Less than a month later, the deal is now worth $50 million. But in a company earnings report this month, Maximus touts its 6-month job in Florida at $73 million. As recently as this month, the state suspended admissions and determined a Lafayette Village in Brandon posed an immediate serious danger to its patients after inspectors found no COVID-19 control policies, staff not equipped with personal protective gear, and its 3 COVID-positive residents at the time, not isolated, never sent to the hospital, or even seen by their doctors. Democrat Michael Greco of Miami is a yes, but eager, not so much. I'm a huge wimp with needles, he emailed us. Of Florida's nearly 200 lawmakers, just 15% responded so far. Senator Kelly Stargell of Central Florida told us she has the antibodies, so a shot wouldn't be the best use of the state's limited supply. A few others refused to share their personal plans, calling it a private matter. Of the ones who did, most said yes. Republican Representative Anthony Sabatini of Lake County added, "As a member of the Florida Army National Guard, I will likely be mandated to receive the vaccine, and will take it. If I was not a first responder, I would not seek to take it since I'm not in the high-risk category." Representative Fentrice Driscoll, a Democrat in Hillsborough, told us she hasn't reached a decision, but called for equitable access to the vaccine. We surveyed Florida's 67 school districts and asked a series of questions, hearing back from just about half. Of those who responded, all will require the person quarantined for up to 14 days, what the CDC recommends. Less than 10 will mandate at least 1 negative test before the person can return to campus. And a handful plan to make the entire class get tested. But most school districts who we heard back from said if there's a positive case on campus, they'll seek guidance from their local health department. For months, we've asked. Several media organizations, including our own, even retained attorneys to cut through what has become a pandemic pattern of state secrecy. In August, Florida's health department published this report showing at the time more than 1,600 cases were linked to daycare centers, the majority staff. The report disappeared a day later.
It was a draft that was inadvertently released, but we're in the process of making a report.
But last month, our attorneys confirmed the DOH does not intend to proactively publish any daycare COVID numbers from its disease tracking system.
The public should be concerned.
To date, 184 school districts across the country have submitted requests to FEMA for PPE money. Only 3 have been approved. While the federal Marion County, since day one, the district has reported 58 positive cases, 287 students and staff quarantined. Neighboring Alachua County offers free testing to quarantine students on day 3 and day 9 of their 14-day seclusion. And in Martin County, where its schools have reported 24 positive cases with 600 quarantined since day one, the county health department told us in part, the Centers for Disease Control and Prevention does not recommend universal testing of all students and staff. Hillsborough County, the state's 3rd largest school district, is touting a near-perfect teacher retention rate this year.
We've been really aggressive with our recruiting efforts to be able to create a longer, stronger bench.
According to school board documents, between mid-June and mid-August of this year, more than 1,000 teachers have opted for a leave of absence or resigned from the district, actually down 3% from last year.
You're always going to have a number of teachers, positions that you'll have to fill through attrition.
Around the state, just over a dozen school districts responded to our request for teacher retention rates. Many reported rates of 90% or higher, and typical, they say, of recent years. Many more told us they were still working on it or didn't respond at all. According to the Centers for Disease Control, schools should have 1 school nurse for every 750 students. In Florida, the latest state data shows it's 1 to more than 2,390 students. According to the voting rights advocacy group Florida Rights Restoration Coalition, of the 1.5 million ex-felons in Florida, 87,000 or 6.2% registered to vote in the 2020 election. It remains unclear how many actually voted and which party they voted for. Of those with kids in grades K through 12, the majority who responded, Republicans, who told us they are sending their children back to campus. This was not an easy decision for us, stated Republican Representative Nick DeCigley, whose kids attend a private school on Florida's West Coast. Democratic Senator Jason Pizzo of Miami told us he's undecided, but as of today would not be comfortable sending his kids back to campus. For the past month, we've combed through school district records around the state, seeking the number of teachers who have resigned, retired, or took a leave of absence since the start of school. We found hundreds. In St. Lucie County, 36 teachers dropped out halfway into the first semester, double the number this time last year. In Orange County, 118 teachers are gone, a 25% increase from this time last year. And in Hillsborough County, a district spokesperson told us they have 100 more teachers on leave right now versus a year ago. Not an unusual pattern, a district spokesperson told us in an email, adding they're not concerned. In Manatee County, over the first 10 weeks of school, a dozen school nurses have left, more than 10% of the district's nursing staff.
It's more than we would like.
In Pinellas County, 13 school nurses are now gone. And in Palm Beach County, 43 school nurses have retired, resigned, or took a leave of absence since the beginning of the school year. Last month, Florida's Education Commissioner and former state Republican House Speaker Richard Corcoran signed an executive order mandating schools offer students in-person instruction 5 days a week. A few days later, President Trump issued a pressure-filled tweet that even threatened to pull federal funds from schools that don't open. So far, the virus has invaded more than 400 long-term care centers, infecting more than 2,600 residents and staff, and ultimately killing nearly 400 of them, according to cases reported to Florida's health department. As Florida makes national headlines for becoming the world's new epicenter of COVID-19, reaching its own record highs for deaths and hospitalizations, data we've analyzed suggests the pandemic's most extreme impacts on the Sunshine State may be deadlier than what state leaders have told the public.
We're undercounting the COVID-19 related deaths.
Dr. Tom Tsai is a surgeon and health policy researcher at Harvard University. He says the true cost of the pandemic can best be described by something called excess mortality.
And across states in the United States and on the national level, we're seeing an uptick or an increased number of deaths than otherwise would have been expected or predicted during this time period.
Let me explain. This is the average number of deaths in Florida during the month of April over the past 5 years. You can see each April about 17,000 people die in our state. But this past April, that number spiked to more than 19,000, which means there were more than 2,000 deaths above and beyond what was expected under normal conditions. This is what the health world calls excess mortality.
It gives us a sense of the true magnitude of what the pandemic is.
The state only attributed COVID-19 to just over 1,000 deaths it reported in April. Dr. Tsai explains why some of the rest of those deaths could also be attributed to the pandemic.
Part of the excess mortality, excess deaths, may be due to patients or individuals with non-COVID conditions, things like heart attack or cancer or stroke, who were not able to receive care during the pandemic. They're both important in understanding the true cost of the pandemic.
A look at the past 6 months shows why health experts are concerned. From January to June, Florida reported more than 8,600 excess deaths, more than double what the state has attributed so far to COVID-19.
It's as close to a smoking gun as you'll get in statistics. It's really clear there's something going on.
Dr. Troy Quast is a health researcher at the University of South Florida. He says the increase in excess mortality data is a sign the state may be underplaying the virus and its true death toll on Florida.
It does lead you to think that there might be at least more investigation is warranted.
Dr. Tsai agrees and warns with the state's recent surge in cases, Florida's death rate will go up, while Florida's window to control it is quickly closing.
This is not the time for half measures. This is a time for focused action to truly flatten the curve on the pandemic in Florida. We don't want to see the pandemic show itself in the fatality numbers. That's too little, too late.
Call it the silent campaign behind any election, and they are the often unknown, unseen minds behind it.
I think it's going to be a quiet evening in Florida.
I hope nothing will be the equivalent of the hanging chair.
Fort Lauderdale-based Mitchell Berger and Tallahassee's Mark Dunbar are longtime election lawyers in Florida, hired by campaigns to ensure voting systems work, voting laws are followed, and voter ballots counted.
It's hours of boredom and moments of terror.
Terror they both remember well. In 2000, Dunbar helped represent the Bush campaign. Berger, former Vice President Al Gore, when Florida's infamous hanging chads and butterfly ballots forced unprecedented lawsuits, recounts, and a final decision for the nation's highest office by its highest court.
That was not fun.
20 years later, Florida's election technology won't be the issue, they say. Instead, Berger, who's now part of the Biden-Harris legal team, expects any court battle here to focus on the unprecedented surge in mail-in ballots.
If people are attempting to challenge your signature or challenge your ballot after it has been mailed, there will be people who will stand up for you.
Dunbar's focused on deadlines, specifically for votes by mail. Questions over voting deadlines are at the core of more than a dozen pre-election lawsuits filed nationwide.
When voters have to get those ballots in the mail back to the supervisors.
Absentee ballots are going to play a tremendous role in the election.
FSU Associate Professor Michael Morley studies election lawsuits. 2020, he says, is already making court history.
This is the first election cycle where we've had hundreds of cases before the election challenging virtually every aspect.
How Florida swings this time around remains to be seen. Urban counties with more voters will likely remain hot precincts for poll watchers and legal teams, gearing up for a night fueling so much projection, anticipation, and hope. This election is decided by voters and not lawyers and courts.
Hoping that all we're doing is drinking beer and eating pizza.
In 2000, we had jets fueled and ready to go. There were a lot of jets who were moving around, moving lawyers all around. I don't think you have to worry about jets this time around.
Contact tracing. Experts call it critical to stopping the spread of COVID-19.
We've got to be on it like this.
In Florida, the practice of tracing the virus from person to person has had its challenges.
I still haven't gotten a phone call.
The young lady who called, she wasn't knowledgeable at all.
But with the reopening of schools prompting concerns about case spikes, contact tracing on campus remains a work in progress.
In terms of challenges, it's just another place to go do contact tracing, really.
Pinellas County currently has 100 tracers. While additional hires may be necessary once schools reopen, the process of tracing students will largely be accomplished with adults, according to the county health department.
We would talk to teachers and parents and responsible adults. I mean, we wouldn't do contact tracing with a 6-year-old.
Across the state, 4,400 tracers are now on the job, with some counties ramping up rosters before the school bell rings. Lee County plans to add 78 people to help trace. St. Lucie County is in the process of hiring an additional 20.
It's in combination of school opening in the next several weeks, as well as just managing our regular caseload.
Health departments will lead tracing efforts for schools, and while younger patients may pose challenges on the Q&A, health officials fear the lack of rapid results will pose the biggest challenge for tracers trying to contain an outbreak on campus.
The sooner that we are aware of a positive case, the quicker that we can reach out.
But doctors, critical of the state's plan to reopen schools, remain concerned.
The state already doesn't have enough contact tracers in general without a school reopening.
During a press conference with the governor earlier this week, Education Commissioner Richard Corcoran disclosed there's $500 million in CARES Act funding Florida schools have yet to spend.
We still have, I want to say, almost $500 million in unspent CARES funds for the districts. $500 million.
Which sounds like more than 100 days after being awarded the money, districts have collectively spent a fraction of the nearly $700 million allocated to them for products, services, and people needed to educate students amid an ongoing health crisis.
They're going to be able to plug those holes.
In fact, this spreadsheet provided to us by Florida's Department of Education shows nearly all school districts in the state have spent less than half its allotted dollars, with the majority still holding on to at least 75% of its CARES Act funds. Some have yet to spend a dime, according to the state.
It looks like school districts are really slow to spend this money.
It appears that way, but I will assure you that we are not.
This week, Pasco County Superintendent Kurt Browning found himself defending his district's spending habits, or lack thereof. Of the $14.5 million in CARES Act dollars Pasco schools received, the state shows the district has only withdrawn $2.5 million.
They'll say, you got to spend that money. You got to spend that money. And we're going, well, we are spending the money.
The problem, Browning says, is a rule that requires districts front the money, spend it, and only then ask the state for the reimbursements.
Why wouldn't you just give us the $14.6 million? I mean, it's not like we're going to go to Tahiti on this.
In Lee County, according to the state, the district has spent less than 10% of its $22 million. But a school spokesperson said they're waiting for another $3.5 million in reimbursements. Same in Miami-Dade, the state's largest school district, awarded the largest cash flow of CARES Act dollars. On paper, the district has withdrawn less than 1% of its $120 million pot. But according to a district spokesperson, another $20 million is in the reimbursement pipeline.
We had the plan, so there really was no reason to sit.
Only a handful of school districts have spent most of their allotted funds. To date, Charlotte County Schools, a small district, awarded just over $3 million, has spent 70% of it, the largest percentage of any school district.
The less you have, the faster it goes. There's no question about that.
Some districts that appear to be slow spenders point to shifting priorities and changes in other funding for the spending delay.
We've probably spent more on PPE than I will tell you than we've ever had budgeted.
Still, Superintendent Kurt Browning remains concerned what looks like shy spending on paper could cost schools in the long run.
Legislators are looking at the amount of CARES dollars that aren't being spent yet. They're going to say, well, if you have $500 million sitting here, why do you need more money?
Vote early, vote by mail, vote in person, just vote. But how often are votes in Florida a crime?
You are being charged with voting fraud.
Right. Absolutely right.
Larry Wiggins is the latest Florida man to be arrested for attempting to defraud the state's election system.
What were you thinking when you went ahead and requested a mail-in ballot for your wife who is deceased?
I was thinking that they weren't going to send it, and they didn't, and I was glad they didn't.
Wiggins claims he was just testing the system when last month he requested a mail-in ballot in his late wife's name and then signed her name for it.
I just wrote down her name both times. That was it. But I wasn't, I didn't think they was going to send it anyway.
He's now facing 1 count of vote-by-mail fraud. One of few we found in Florida who since 2016 have voted or tried to illegally. Using court case data from Florida's Office of State Courts, we searched for cases involving people charged with voting more than once in an election and discovered in the past 4 years, the state has charged at least 6 people for casting more than one ballot in any given election.
So many people moving in and out of Florida, it seems plausible that there's more.
But Tampa-based political analyst Dr. Susan McManus says Florida election leaders have become good at finding voters registered in 2 states. The state also recently joined a national voter registry that helps flag duplicates. Still, getting caught is a third-degree felony and comes with stiff penalties, up to 5 years in state prison. In the cases we reviewed, most ended up on probation. At least one dropped completely. Dave Ehrenberg is state attorney in Palm Beach County.
Building a case usually requires witnesses, evidence, and willfulness. And so it's not that easy.
The real opportunity for fraud does lie before the election itself takes place. And it usually occurs in the registration process.
Did you learn your lesson?
A lesson, oh my God.
Which brings us back to Larry Wiggins, who still believes he didn't break the law, just made a mistake. He hopes, in the end, the law votes in his favor.
I don't want to break the law anywhere. I'm a law-abiding person, and I always do the right thing.
I'm I-Team investigator Katie LaGrone, taking action for you.